Good afternoon. My name is Jessica Johnson, and I am a critical care registered nurse. And I tell you that because I retired from critical care nursing, where I gave out all kinds of medications to help people lower their blood pressure or raise it. Now I am working in a primary care clinic. So, approximately 2 years ago, a young lady walked in, fell in my arms, and had a stroke. Luckily, it was not a bad stroke, but when we took her to the hospital, and then I asked her, "Well, do you have high blood pressure?" She says, "I don't know because every time I go to the doctors, I get scared, and then I leave, and then I get agitated and I leave." That's called white coat syndrome. Today, I am here to talk to you about knowing your numbers. American Heart Association says one person dies from some type of heart disease every 37 seconds. In 2014 to 2015, Americans spent $219 billion on heart disease. It's imperative that you know what your numbers are. Today I'm going to talk to you about your blood pressure. I'm going to explain your blood pressure, what it is, how your blood pressure is measured, and what those numbers mean. Next, we're going to look at what happens with untreated high blood pressure. Untreated high blood pressure can lead to other health threats. So I'm going to tell you why also high blood pressure that is untreated is considered a silent killer. And lastly, we will look at some other high blood pressure health threats and what happens when your blood pressure is untreated. When your heart pumps blood through your arteries, the blood puts pressure on your artery walls, and this is called your blood pressure. Now, your blood pressure is measured with a sphygmomanometer. That's just a big word to say a blood pressure cuff that goes on your arm. The blood pressure cuff houses a meter for measuring air pressure in the cuff, and then you have a stethoscope to listen to the sound of the blood that makes it flow through the arteries. The cuff is pumped up. The cuff is placed around your arm and pumped up to occlude the blood flow that is released as the stethoscope is placed over the artery to hear the sound and monitor the number that the sound makes. Those sounds, it makes two sounds, the first number and then the second number. Those two sounds are the different phases of your blood pressure. So remember I said there are two distinct pressures, and they are read as one number on top of another number. The top number, which is called systole, don't worry about it, I don't remember it, but when your heart beats, it squeezes and pushes the blood through the arteries to the rest of your body. This force creates pressure on the blood vessel, and that is your number, that's your first number or the top number. American Heart Association recommends that it's less than 120. Now, the bottom number is the pressure in the artery when the heart rests between beats. And this is the time when the heart fills with blood and gets rest and gets oxygen. And the American Heart Association likes to keep that number less than 80. The American Heart Association considers anything that is your top number greater than 129 or your bottom number even less than 80 as being elevated. Anything over any number between 130 and 139 systolic or top number greater than 80 or bottom number is high blood pressure or diastolic. Only your doctor can give you a diagnosis of hypertension or high blood pressure. And they do not do that easily or readily, but will monitor it for a short time prior to you coming back or while you're in the doctor's office. They will monitor you to ensure that you don't have anxiety or white coat syndrome. Myself in my practice, when my patients come in, I don't even take their blood pressure initially. I sit and I talk to them and we chat, and then I will check the blood pressure. But it's important for you to know what your numbers are. You should know what your blood pressure is, because we don't want you to go into the doctors and your blood pressure is elevated just because you're in the doctor's office, and so therefore you may have what's considered white coat syndrome. That is when you go to the doctors and you get agitated because you're at the doctors, and then you will have white coat syndrome. However, if your blood pressure is elevated repeatedly, you will be given medication in the office or a prescription and a follow-up appointment because of the seriousness of your untreated blood pressure, high blood pressure, or hypertension. Untreated high blood pressure can lead to heart disease. Now I'm going to say that again. Untreated blood pressure can lead to heart disease. Many people have high blood pressure and they do not know it. High blood pressure does not have any symptoms, and that's why it's called the silent killer. Also, sometimes if there are symptoms, people misunderstand them. I'm going to repeat this phrase. Untreated high blood pressure can lead to heart disease, and it can also lead to stroke or any other health diseases. Heart disease and stroke are the two leading causes of death in America. Untreated high blood pressure can also lead to vision loss, heart failure, heart attack. It can also lead to kidney disease and sexual dysfunction. As I conclude, I would like to inform you that when you have untreated high blood pressure, it weakens the arteries, which will eventually lead to heart disease, stroke, or worse. Hypertension or high blood pressure develops over time. There's no cure for it, but it can be managed and arrested if caught and treated. But it starts with you. You must know your numbers. Thank you for listening. Thank you for watching, and learn your numbers. Goodbye.